Well, did you know a lot of disorders are formulated out of trauma? It's estimated that 6% of the population will develop post-traumatic stress disorder. And joining us to talk more about this Health Team 6 topic, Dr. Hite from the Therapeutic Treatment Center and Therastop. We welcome her back to our live show. And here in the studio, Dr. Hite, it's always awesome to see you.
Thank you, Jess. So nice to be here again.
Yes, wonderful to have a conversation that is so key. June is National PTSD Awareness Month. We hear of this often, but for friends who are not necessarily intimately familiar with what this means, can you define this scenario?
Well, first, I want to say that PTSD is usually associated with war and war victims. But PTSD is so much broader than that. You know, it's anything that has happened from a traumatic event to someone throughout their lifespan that has caused ongoing significant symptoms such as flashbacks, nightmares, derealization, depersonalization. And what I mean by derealization and depersonalization is out-of-body experience. They become detached from the trauma as if they're blank, and they're not being able to live and go through life like they need to as a result of the trauma.
Dr. Hite, you mentioned typically we associate this with war and with and I think it's only been somewhat recently that we've started to have that conversation aligning those two. So now are we thinking of it beyond that particular category?
Correct. So what people do not understand is that you do not develop PTSD first. What you actually develop first is acute stress disorder. And that's about a month of the symptoms. It's once you go past acute stress disorder is when you develop PTSD because of your inability to cope with the symptoms that were brought on by the traumatic event. And so when it becomes broader, you can also have vicarious PTSD. For instance, say I was in a domestic violence relationship and my child witnessed me being abused. So then my child would start developing those PTSD symptoms. And you can be diagnosed with PTSD as little as 6 years old. And so it's more broader because it can come from just any life events that has caused a traumatic event to happen to you.
That was going to be my next question. Is there a certain age parameter where this can be experienced? And how are there signs, are there symptoms, are these things that we would recognize in ourselves or a loved one, or is this something diagnosed by your health professional?
Well, no, you can recognize those symptoms if you have difficulty talking about it. You know, say for instance, you're just having tea with a family member and they're talking about the event that happened and you're struggling to articulate or find your words to talk about it. Or you feel some type of physiological effect. You feel your stomach hurting or your hands getting clammy because you're talking about that event. You know, those things you can start monitoring yourself, especially if you have nightmares or flashbacks. That's a lot, the first indicator when you wake up, you know, because of you're having and reliving the moment consistently.
Once it is determined that this is what's occurring, what happens next? Are there treatments? Can we move through this? Is it something that stays with you that can be triggered or activated again?
So what it is your prognosis. If you have other mental health disorders, obviously your prognosis can be poor in relative to that. But there are treatments to it, therapy as well as medication. You know, sometimes medication is given SSRIs that helps with anxiety and depression, can also help with that. They also give you sleep medications to help with the flashbacks and the intrusive thoughts from the trauma. But a trauma-informed therapist is the best therapist to seek treatment from because they specialize in traumatic events, especially things that come out of PTSD. You can live with PTSD, but it can be reoccurring depending upon if other traumatic events continue to happen in your life.
The conversation, and you mentioned that key phrase, a trauma-informed therapist. This is certainly an area of focus because when trauma is experienced, I was reading an article the other day that it perpetuates generationally, like this continues.
It does. It does, and that's what I was speaking about vicarious PTSD, because family members or someone close to you continue to see you relive that trauma, especially if you don't get help. You know, another thing that you can do is EMDR. That's another traumatic therapy that someone can do to help desensitize in reference to the PTSD symptoms that they are experiencing.
For friends watching today, and you said that the journey, the mental health journey, continues to be incredibly busy, incredibly in high demand. For folks watching today thinking, I need a little help, this could be me, it sounds like some of the things I'm experiencing, what's the best way to get started?
You know, you can go and research Psychology Today. You know, I mentioned that a lot of times, that you can go find someone. Make sure you look for trauma-informed therapists specifically. I'm not saying other therapists cannot help you with the trauma. However, a trauma-informed therapist is really trained into delving into that trauma and giving you coping skills to assist with the trauma. Also, medication may be the need. You know, medication can, some people are weary about medication, but you got to understand, if you're having those flashbacks and nightmares, medication can help calm, you know, those intrusive thoughts and those flashbacks and nightmares.
It may work in tandem with your therapy so that you come out to an ultimate solution. Thank you so much,
Exactly.
Dr. Hite.
Thank you so much. Thanks for having me
I
again.
appreciate talking with you
Thank
very
you.
much. An important conversation. For more on this topic or the services that Dr. Lakeisha Hite provides at Therapeutic Treatment Center and Therastop, you can visit our show website later today, virginiathismorning.com. Our live Wednesday show returns right after this break.